Hello, today I'm going to talk to you about Discern Health and its predictive models and their integration into two Microsoft offerings, namely the Medallion architecture and Fabric for Healthcare. My goal is to discuss the impact that this collaboration can have on care delivery in the United States. We know that a massive opportunity exists to leverage clinical data to help avoid life-altering events with costly outcomes. Discern leverages our data assets on 77 million patients, 25 million clinical data elements, and 1.5 billion claims to offer longevity models specifically tailored to older age communities. There is a growing multi-pronged problem in healthcare. The United States spends 18% of its gross domestic product on healthcare, nearly double that the next developed nation. 25% of healthcare spending, a staggering $100 billion, comes from overtreatment or low-value care. This is particularly a concern with the aging of the U.S. population. In 2020, 57 million Americans were over age 65, representing 17% of the population. By 2035, the number of those over age 65 will exceed those under age 18. These patients have complex care delivery models, with the average senior seeing between 7 and 29 providers a year. They are at risk for readmission, with 20% of them suffering this fate post-hospitalization within 30 days. This is particularly a challenge caused by access because 50% of them fail to follow up after hospitalization. They cost a substantial amount to the U.S. healthcare system. The average couple over age 65 will spend over $300,000 in retirement, and this cost of care will exceed Medicare projected spending. Couple this with a reduction in provider workflow. In 2021, nearly 120,000 physicians left the workforce with only 40,000 joining. The same is true for other clinicians. By 2026, there will be a shortage of 3.2 million healthcare workers. Discern is purpose-built to transform data into information, information into knowledge, knowledge into insight, and insight into wisdom. We are human-centered. Human insight and impact guide every bit of our work. This is done with clinicians and data scientists collaborating on driving clinical explainability. We do this to empower providers so that they can empower their patients. Data has mighty scale. One person will generate thousands of new healthcare data points from multiple sources, be it claims, clinical data, or social data. Discern coalesces these into insight. Life-changing predictions are our mantra. One harmful event can forever change the course of a person's life. We seek to change that outcome in a data-driven fashion. As stated prior, we are about the collaboration of data scientists, informaticians, clinicians, and product leaders. We carefully define problems and propose models with the correct product market fit. We create, train, and audit these models with the central tenet being to deploy them with the full collaboration of these important internal resources. I'd like to showcase our impact using our Falls model as a champion example. Among the aforementioned seniors, we know that 80 million of them are in CMS-sponsored plans. We know that a quarter of them will fall annually, and costs for falls can range from $10,000 as an outpatient to $20,000 as an inpatient. This leads to healthcare spending of nearly $30 billion annually on falls alone. Falls are a challenge to predict, and this is amplified by discrete and fragmented data. Take Edith, for example. She presented to the emergency department in September of 2023 with a trip and fall, sustaining a right femoral neck fracture. She has multiple documented medical conditions dating back to 1993 in her claims and clinical data. She sees multiple providers, be they generalists or specialists. On admission, she was found to have gastrointestinal blood loss and a resultant anemia. Her 2023 timeline was not only marked by clinical decline, but evidence of mobility and independence loss, increasing personal health care and personal costs, and a reduction in her support network in housing, transportation, and food insecurity. Some of these elements were captured as structured data. Many were unstructured. Take, for example, that she documented that she'd be better off dead shortly after her husband died in May of 2023.
Raw clinical data poses a lot of challenges for us. Our clients can give us data in a number of formats, including claims, FHIR, CCD, and many more, that also have varying levels of information and quality. In this example, we've taken claims data, and after we've built an adapter, taken that claims data and converted it into FHIR, which our API also accepts, and now we can load it into a Fabric lakehouse. Let's take a look at a claims resource and what that looks like in Fabric. So now you can see here you've been able to query an example bundle, create a bundle. Here is an exact claim resource from a patient. So FHIR, or Fast Health Interoperability Resource, is a format that healthcare data solutions and Fabric uses in their bronze and silver layers, more on the medallion architecture layer. Our API actually takes in FHIR, and we've set it up that way so it's able to work natively with data from a client's lakehouse in Fabric. In practice, we'll use Azure Health Data Services to convert client data to FHIR, and then we'll send that to be ingested into the raw or bronze layer. Let's take a look at a bundle. So here we've been able to query a bundle from the lakehouse using our utility for this patient. Here's the claim example that we just looked at. Let's look at the bundle. So bundle is a collection of FHIR resources. In this case, this example bundle has 294 different resources. And breaking that down even further, 293 of these are claims, and one of these resources is a patient. One of the key tenets of the healthcare data solution in Fabric is a medallion architecture, where there are 3 layers: bronze, silver, and gold. Bronze layer represents the raw data. So in this case, the transformed FHIR claims data. Silver represents a transformed, more clean view of it. So in this case, Fabric has a solution out of the box that takes in raw FHIR data from the bronze layer and flattens it into semi-relational FHIR. In this case, the transformed claims resources. Gold represents a more curated, report-ready view of the data. In Fabric, this is usually OMOP. We're not focusing on OMOP or the gold layer here. So here's an example of us querying the bronze lakehouse. In this case, to show some example claims. You can see all the claims here, as well as practitioner and patient. All right, so we've been able to set up a utility to pull all relevant FHIR resources from the client lakehouse for a specific patient. And we've also set up a utility for the client to be able to access our API and display the results of the falls risk model. Let's take a look at a few examples. All right, let's run an example and get the fall risk score for a specific patient. All right, so you can see here, this is what we're going to get from our API. So we're going to return back longitudinal fall risk scores for a specific patient. In the FHIR notebook, we set up a utility to actually make this plot. Clients will be able to access these plots and create these plots out of the box from the results from our API. As part of our API response, we also return back the risk factors. So we also return back, this patient had fall history, they had hearing loss, unfortunately they had constipation and anxiety. Returning back the earliest times and latest times that these specific codes appeared. These codes being the codes that we actually flagged in the patient's history. Let's look at another one. So here's another patient, frailty, weakness, incontinence, memory loss, different risk factors here. Same longitudinal fall risk score starting in 2016, with the highest risk score here in May 2020 with a score of 0.56. So now you can see that the hard work of getting a client's data into a trustworthy state in unified format is handled by Fabric here in the lakehouse. And all we as Discern have to do, set up a utility to query the relevant pieces, send to our API, and show back. This provides easy onboarding for Discern clients and is enabled by Fabric.
Our models have clear impact on all players within the healthcare ecosystem, be they providers, payers, patients, policymakers, or the public health system. Our falls model identifies high-risk patients a year in advance with unparalleled accuracy. We have an area under the curve of 0.85 compared to industry standards hovering at around 0.57. Assuming our model leads to intervention on a fraction of those who are at risk for falls, the impact could represent billions of dollars saved per year spread out across 80 million seniors. We present the data to a user where they can see a splay in risk as can be seen at year 1.5 on this graph, or when the probability of falls exceeds a threshold as can be seen in year 2, when that risk exceeds 50%, more than that of a coin flip. Taking this to a small payer with 24,000 members, where 940 falls are expected in a time period, leads to an extrapolated $15.41 per member per year savings on fall risk reduction alone, spread out across 24,000 members. These models have a negative predictive value of 0.96, a positive predictive value of 0.62, and only 1.71 falls are needed to predict one costly fall, as well as its personal, family, and healthcare-related impact. Thank you very much. If you're interested in learning more about Discern Health, visit us on our social media channels on Instagram and X, as well as on our website at discernhealth.ai.